Hey everybody, welcome back to I Know a Guy. If you're new here, my name's Anthony. I'm a business profit advocate. On this show, we interview entrepreneurs, business owners, professionals, and just people doing cool things. For example, today we're meeting with Tiffany Roggia. She is with Impact Health Sharing, and she helps individuals save anywhere from 30 to 50% on their healthcare. How are you doing today, Tiffany?
I'm doing fantastic. I'm super excited to be here, Anthony. I've been watching some of your previous interviews and just grateful to be here.
No, I'm excited to have you. We've talked a few times. We're both part of the Connected community, so we definitely know a lot of the same people. And I just see, day to day the cool things that you guys are doing over there. And I think more people need to know about it because healthcare in this country, it's almost a trope that it's not bent, it's broken. So having some alternatives and some people that are experts in the alternatives is super important for people to hear. So really happy to have you on. But where are you calling in from? Where are you located?
I am in Boise, Idaho. Originally, I used to live in Florida, but my husband and I moved here about 2 years ago, and it's been fantastic. There's more than potatoes here. I love it.
Yeah, yeah, that's a bit of a culture shock coming from, I imagine from Florida to Idaho, but recently married too, if I remember right, correct?
Yes, recently married, the whole 9 yards.
Okay,
We have a
well,
puppy.
congratulations. That's all awesome. Awesome. So you've been in Idaho for a little bit. What's fun? I've never made it there. As far as I know, people mistake Idaho and Iowa all the time, but it's
Yeah.
different, but kinda. What's fun in Idaho? What do you recommend people do when they visit?
I would say if you love outdoors, then Idaho is a place to come. I probably shouldn't be saying this because we like to keep the secret here, is what I've been told. But it has the most amount of hot springs than any other state in the United States. There is literally anything that you can think of outdoors, hunting, kayaking, anything, fishing, right? Literally everything is here. And the beautiful part that I would say is that you can take advantage of the full summer because it's dry heat. Me coming from Florida, oh my goodness, forget about it. Stepping outside was like it was a torture for me at least. So over here, I feel like I can do absolutely everything, even in the winter, right? We have skiing, snowboarding. I mean, I would say again, if anybody loves nature, then Idaho's definitely the place to come and visit.
Awesome. Yeah. I'll definitely, it's on my list. It definitely is. I need to get out there because Iowa winters and summers are both rough. We get all the seasons and we get them good and hard. So I need to try some other stuff. So,
Yeah,
uh,
we're pretty sheltered here because we are in the Treasure Valley, so that's what I've been told at least.
yeah, yeah, definitely checking it out. So, what can you tell us about what you're doing?
Yeah, so I am with Impact Health Sharing, and what we're doing is we are an alternative to traditional healthcare in the sense that it's considered healthcare sharing. So it's not a new concept, Anthony. It's been around for 40 years, but a lot of folks who have come across this concept is generally it's religious based, right? So you have to be a part of a certain religious group to be able to share into bills, but essentially it's just a sharing economy. It's people coming together and saying, "Hey, we're paying too much for healthcare. Let's band together, let's create a pot of money, and let's share into each other's bills," right? So that's how it started. But what we have here with Impact is a come one, come all approach. So we welcome everyone regardless of what they believe in. So that's the main difference between Impact and any other healthcare sharing organization. And the beauty of it is that we feel and touch like traditional insurance. So we have deductibles, which we call it a primary responsibility amount. Same, similar terms, but like the same function, right? So we feel like traditional healthcare. You have your deductibles, your primary responsibility amounts. You get to pay a certain amount per month, every month. And then you have that peace of mind. But we have a non-for-profit approach of healthcare sharing that makes it different from traditional insurance. So what I mean by that is we reprice medical bills, for example, on an average of 72%. So that's huge for a lot of folks out there, right? There's a lot of Americans that unfortunately they're in healthcare debt, right, due to medical bills. So little things like that is what makes Impact special. And then the last thing I want to add to that is that we're unique in the sense that we have technology wrapped around this concept that has been around for a while. So the other healthcare sharing organizations, they're fantastic, right? But we have the technology here that allows the algorithm to match families nationwide to share into their bills. So that's what makes it special, right? So not only are we modern and contemporary, but we're non-for-profit. So that's kind of a gist of what Impact is.
That's awesome. Yeah, having more competition in that space and alternatives is going to do nothing but help it out. So, how did you get started into it? Nobody in my experience has ever went through high school and said, "You know what I want to do when I grow up." So, what led you to that?
Yeah, fun. I love that question. So my background is actually in real estate, and before that, I was computer science. But anyways, that's another story. So real estate, I've been doing that ever since I graduated from university. Love that. One of the things with being self-employed, as you may know, Anthony, is we're always looking for healthcare, or at least maybe we stop looking because it's just simply unaffordable, right? The hope and pray plan is what we call it. But so being that I was always looking for an option that was affordable, that made sense, and I would take advantage of the tax credits, but then I would make too much income and I'd end up owing in taxes. So my broker actually told me about this impact, and he's like, "Hey, you're young, you're fairly healthy. This might be a great fit. Check it out." I'm always open to things, so I checked it out. It made sense on a business level, right? It saves you anywhere from 30 to 50%. But what I really and truly cared about is, hey, will this work, right? So I'm fairly healthy and never expected to have anything happen, right, as per usual. But I actually had a car accident, and before that, I broke my fifth metatarsal playing volleyball of all things. So, needless to say, I have some experiences to back the fact that impact works, right? One of my bills was $13,000, and essentially it brought down to way less than that. I mean, like 1,500 essentially. So I truly feel like this is something that works now that I've been able to use it. But my background, again, real estate, came across this as a way to save money, saw that it worked, and here I am sharing it with other business owners and individuals.
Yeah, I like that. I like that a lot. When people have like a natural introduction to something where it's like didn't know this existed, I used it and it saved my butt. Now I want to go advocate for it and talk to it. That's awesome. I love those kind of stories because you're coming from a place of not only is this going to help you, it's helped me. So I'm, all in on it. So that's
Yeah.
awesome. So what's your favorite thing about what you're doing?
My favorite thing is that I still get to help people. So with real estate, what attracted me is being of service to people, helping them find a home that they loved, right? But now here, I get to help them find healthcare they're gonna end up loving it once they see that it works, right? And usually people have an off feel to healthcare, but now I feel like, hey, I'm bringing a solution. I'm helping families, individuals, businesses find an affordable way to have healthcare. So it's just a rewarding feeling. So I would say that that's my favorite part of it.
Okay. And you've been an entrepreneur for a while. Like you said, you were in real
Oh,
estate.
yeah.
Now you're doing the impact health share and stuff. What are some hard won lessons that you've had over the years that maybe you'd share with other blossoming entrepreneurs, or maybe things that you would do differently if you could go back?
Yeah, absolutely. Wow, that's a great question. And there's so many things I can say. But the main thing I would say is when you're networking, because that's crucial when you're, self-employed and you're an entrepreneur, is to go in with the mindset of giver's gain, right? You always want to give, give, give before you take anything. And the great guy Phil was actually saying it's kind of like a dam, right? You want to fill up that dam until it bursts, right? It gives back to you at some point, but you don't want to go in with the mindset that you're going to get something out of someone. So I would say that's the biggest thing to always keep in mind is, hey, how can I help this person? Who can I connect them to? How would this help? Because it will always come back to you in one way, one shape or another. But I would say that's the biggest key that I've learned, and it's what really transformed my business. I just go in with a servant's heart, and I know eventually it'll come back one way or another.
That's my favorite answer, by the way. It's been a recurring theme with most folks that I've been interviewing and having conversations with, where it's not new. We're just saying it a different way. It's, filling up the dam until it bursts. It's help enough people get what they want, you'll get what you want. It's you reap what you sow. It's karma. It's universal human law, and we're all kind of discovering it on our own and having different words to describe it. But it's real. It happens. That's the reason that it's a trope. So that's awesome. That is absolutely, like I said, my favorite my favorite answer to that
Right.
question. So, what about your average client? Do you mostly focus on individuals? Do you focus on groups, businesses, or how does that look for you?
Yeah, so the main thing that I'm looking for is people who are fairly healthy. So mainly they don't have a lot of pre-existing conditions. It's on a case-by-case basis, but I usually take a look at, how would impact fit in their life. But again, traditionally healthy. And as far as my target customer, it's truly anyone, whether they're an individual, a family, or a business. Traditionally, businesses of 49 employees and below is where it's my sweet spot. But again, it's just mainly anybody who's healthy, who's just tired of paying way too much for healthcare. That's the type of individual that I can help.
Okay. How about power partners? What are other folks that maybe are in similar industries or parallel industries where you're helping the same people that might be good synergies with what you're doing?
Yeah, that's a great one. I would say fractional CFOs for sure, because they're looking at ways to save business owners money, right? We're already both doing the same thing there. So that's a great partner. Definitely realtors. A lot of us, I believe it's like what, 6 out of 10 of us don't have healthcare. So I would love to make a difference for my fellow realtors out there. Definitely don't want them to go into a car accident like myself and then end up with a $13,000 bill, right? So I would say realtors, fractional CFOs, and definitely, again, anybody who's a business owner, particularly who are saving the business owner money, that would be a great partner for me. And then, of course, lastly, how can I forget this? Anybody who's in the health insurance market, right? So they can actually, join me and along and just share impact with other folks as well. So that they would be a great partner as well.
Awesome. A lot of people hear things about health shares, and like you said, they knew them as the traditional ones where they were faith based. You had to have a pastor interview for you, things like that. And a lot of times you might get the 30 to 50% less. That seems too good to be true. How do you answer that question when somebody asks, "Are health shares legit?"
Yeah, so I usually just back it up to the fact that it's been around for 40 years, right? It's not a new concept. The beautiful part, though, about impact is that we haven't denied any of the claims since we have been established, which is about almost 6 years, right? That's huge to say when you consider it to the denial claims that are happening with traditional insurance, right? So that's the main thing that I like to point out there. But it's just, of course, it's been around for a long time now. So in that sense, we can back it out by the timeline. But I mean, it works. I mean, truly for me, it's just from a personal experience. I can share my stories, share the portal, which I think I didn't mention that earlier, but everyone gets access to their member-owned portal and they can see how the money moves when it's being shared, how much money is an overall impact. So you can truly see the, no pun intended, but the impact that it has within the community, how it works. You get to absolutely see everything. The transparency is there. And I truly feel like, the proof is in the pudding, right? You can see everything right then and there. There's nothing to be hidden. So usually I would like to share that portal with folks so they can truly see how it works behind the scenes.
Yeah, and no, that's absolutely the right answer too, because just because somebody hasn't heard about it doesn't mean that it's not real. Take a look at it, especially if you can be completely above board and say, "Here's the transparent version of it. It's black and white. There's empirical evidence right here." Um, just because you've had the wool pulled over your eyes by some of the other companies out there doesn't mean there's not alternative. So it is important to have that conversation. But is there anything that I failed to ask or might have missed that you wanted to add?
Um, no, I mean, you're pretty thorough, and that's what I appreciate about your interviews, Anthony. But truly, I just want to leave it again that we're really trying to disrupt the healthcare space and truly just find, not find, but bring a solution to families, individuals, business owners, those who are just sick and tired of paying too much for healthcare. Actually, now that I think about that, I do have one thing that I want to share with you. In this program, we actually rolled it out this year, which is we're promoting healthcare rather than sick care. So what I mean by that is we have a health and wholeness program where let's say if you go to the gym or maybe you go to a naturopathic doctor, let's say you want to get a massage done, maybe you take supplements, essential oils, literally it's anything that promotes health, you're able to submit proof of payment to the portal and up to $100 will be applied to reduce your deductible, your primary responsibility amount every month, right? So that's up to $1,200 that individuals can take advantage of to reduce the cost of healthcare. And that's huge. I haven't seen it anywhere else. So again, that's another proof that Impact is truly trying to change the healthcare space for the better. And that's one of the main reasons that I love what Impact is doing and why I'm so passionate about the program.
That's really awesome. Yeah, I really like that because the most affordable way to treat being sick is to do it before you're sick. So incentivizing folks to stay healthy, I like that. That's a really good direction to be taking things. So we're not treating the illness, we're preventing the illness. I like that.
And yes.
So people want to have a conversation with you, want to know a little bit more. What's the best way that they reach you?
Yeah, so I would say I will provide the number, but that would be at 912-332-8541. And they're also welcome to click on the link that I will provide to you, Anthony, and that's a great way to answer to reach to me as well.
Perfect. And I'll make sure it's very visible in the description. We don't have to hunt for it. You don't have to go back and rewind trying to get that number. I'll have it posted, so feel free to grab it. And I'll copy and paste it so you don't have to worry about my misspelling as well. So if anybody would like to know more about it, absolutely reach out to Tiffany. She's an awesome person to talk to. She's a wealth of knowledge. She's the exact same as she is in person as she was on here. So don't be afraid. And if you are a little shy or you prefer a three-way introduction, just ask me. I'm more than happy to make those introductions for you. Other than that, if anybody would like to be interviewed as well, feel free to reach out to me. My link tree will be in the description as well, so you can schedule a call. Love to have a conversation. But again, Tiffany, I really appreciate you coming on. I really appreciate everything you guys are doing. And again, like you said, no pun intended, I appreciate the impact you're having on people's
Thank you.
lives. So,
I love it. Yes.
yeah, so absolutely. Let's all get out there and meet some more people. All right.
Thank you, Anthony, for having me.
My pleasure.